First signs. Heart failure is a condition where the heart muscle cannot pump blood as well as it should. It is often called congestive heart failure, or CHF. This name is used because fluid can build up or congest in different parts of the body. It is important to know that the heart is still working. However, it is not working with enough strength to meet the body's needs for blood and oxygen. This inefficiency leads to a variety of symptoms that can develop slowly over time, or appear more suddenly. Understanding these first signs is the crucial first step toward getting help and feeling better. Many people mistake these symptoms for normal signs of aging, but they are often the body's way of sending a clear, distress signal that something is wrong with the heart. A particularly telling sign is difficulty breathing while lying flat. People often need to prop themselves up with several pillows to sleep comfortably. Some may even wake up suddenly at night, gasping for air. This can be accompanied by a persistent cough or wheezing, which sometimes produces a white or pink frothy liquid, a sign of fluid accumulation in the lungs. Another major symptom is a feeling of profound and constant tiredness, or fatigue. This is not the normal tiredness one feels after a long day. It is a deep exhaustion that makes even simple daily tasks feel like a major effort. People may find they need to cut back on their work hours, or give up hobbies they once enjoyed. This fatigue happens because the body's organs and muscles are not receiving enough oxygen-rich blood to function properly. The heart itself is working harder to pump, using up more energy, and contributing to this overall sense of being completely worn out. This can significantly impact a person's quality of life, making it difficult to stay active and engaged in daily activities. When the pump weakens. To truly understand why these symptoms occur, we must look at the basic function of the heart. Think of the heart as a powerful, two-sided pump with 4 chambers. Right side receives oxygen-poor blood from the body. Right side pumps it to the lungs to pick up fresh oxygen. Left side receives newly oxygenated blood from the lungs. Left side pumps it out to the rest of the body. The 2 main pumping chambers are the ventricles. Heart failure happens when one or both ventricles lose their ability to pump effectively. Symptoms depend on which side is failing. Left ventricle weak, cannot pump enough blood out to the body. Blood and pressure back up into the vessels of the lungs. This causes left-sided heart failure. Increased pressure forces fluid from blood vessels into lung tissue. Shortness of breath, coughing, difficulty breathing when lying down. Lung symptoms are the primary sign of left-sided failure. It's the most common type of heart failure. Over time, it can lead to right-sided problems too. Right ventricle weak, struggles to pump blood into the lungs, causes a traffic jam of blood returning from the body. Backup affects veins throughout the body. Right-sided heart failure. Fluid is then forced out of these veins and into the surrounding tissues. Swelling, edema, in the legs, swelling in the ankles, swelling in the feet. Fluid can also accumulate in the abdomen, leading to bloating and discomfort. This fluid buildup leads to a rapid and unexplained weight gain. Doctors often look for other signs too, such as a fast or irregular heartbeat, cool skin, and crackling sounds in the lungs when they listen with a stethoscope. You know these signs, pay attention to them. The body's response. When the heart begins to pump less effectively, the body does not simply give up. It has a complex system of responses designed to compensate for the reduced blood flow. The body senses that blood pressure is low and that vital organs are not getting enough blood. In response, it triggers a cascade of hormones and nerve signals to try to correct the problem. One of the first things that happens is the release of hormones like adrenaline, which makes the heart beat faster and more forcefully to try to move more blood. The kidneys also play a crucial role in this compensation process. Sensing reduced blood flow, they begin to retain more salt and water in an attempt to increase the volume of blood in the circulatory system. The idea is that more fluid will lead to higher blood pressure and better organ perfusion. This increased fluid volume does help maintain blood pressure in the short term, but it also means there is more blood for the already weakened heart to pump. This extra workload puts even more strain on the heart muscle, creating a vicious cycle where the body's attempt to help actually makes the underlying problem worse over the long run. Over time, these constant demands on the heart cause physical changes to the heart muscle itself. This process is known as cardiac remodeling. Side-by-side normal heart, and enlarged, remodeled heart with thickened walls. In an effort to pump more forcefully, the walls of the ventricles may become thicker, a condition called hypertrophy. Alternatively, the heart chambers may stretch and become larger, a condition called dilatation. A larger chamber can hold more blood, but the stretched muscle becomes weaker and less efficient, like an overstretched rubber band that has lost its snap. These compensatory mechanisms are a double-edged sword. The body's attempts to adapt eventually become part of the problem, leading to worsening swelling and shortness of breath as the heart is increasingly overwhelmed. That's the way the system gets strained. When a doctor suspects heart failure based on a patient's symptoms in a physical exam, a series of tests is needed to confirm the diagnosis and uncover the underlying cause. Blood tests are one of the first and most important steps in this investigation. They provide a wealth of information about how the heart and other organs are functioning under stress. These tests are relatively simple to perform and can quickly guide the next steps in the diagnostic process. They help doctors differentiate heart failure from other conditions such as lung disease or kidney problems, ensuring the correct treatment path from the start. One of the most specific and helpful blood tests for heart failure is the B-type natriuretic peptide, BNP, and NT-proBNP. These are natural hormones that the heart muscle cells release in response to being stretched. When the heart's chambers are filled with too much blood and fluid, they stretch significantly, triggering the release of BNP and NT-proBNP into the bloodstream. A high level of these hormones is a strong indicator of heart failure. Conversely, a normal or very low level makes acute heart failure much less likely and prompts a search for other causes like a lung infection. Beyond the specific BNP test, a doctor will order a complete blood count, CBC, which can identify anemia that can mimic or worsen heart failure. Another crucial test is the basic metabolic panel, BMP, to assess sodium, potassium, and kidney function, which also guides safe medication choices. Many therapies, such as diuretics, can affect potassium and kidneys. Baseline and serial monitoring are essential. Liver tests may rise with right-sided congestion. These initial labs sketch the problem and set the stage for the next imaging steps. They really set the stage for what comes after. After gathering clues from blood tests, doctors use imaging tests to look directly at the heart and lungs. A simple chest X-ray is often one of the first imaging tests performed. It is quick and painless, yet revealing. The X-ray can show heart enlargement and, more importantly, fluid buildup in the lungs. Classic congestion. Another fundamental test is the electrocardiogram, ECG. Small electrodes on the chest, arms, and legs record the heart's electrical activity. The ECG reveals if the rhythm is too fast, too slow, or irregular. It can show evidence of prior heart attack and signs of hypertrophy from long-term high blood pressure. The most definitive imaging for heart failure is echocardiography. Echo, using ultrasound to create moving pictures of the heart. Echo shows size, shape, and how well chambers and valves work in real time as the heart squeezes and relaxes. A critical metric is ejection fraction, EF. Normal is roughly 50 to 70%. A lower EF indicates heart failure with reduced EF, HFrEF. Some have symptoms with normal EF, HFpEF, where the stiff heart cannot relax to fill properly. Echo helps distinguish types and guides different treatment strategies. The images really tell the story. Making a diagnosis of heart failure is like solving a puzzle. The doctor acts as a detective, gathering clues and forming a clear picture. The process begins with symptoms and physical exam findings that suggest heart failure. Next, objective tests confirm severity and cause. Labs and imaging provide the hard evidence. A 68-year-old man reports worsening shortness of breath and very swollen feet, with 7 pounds gained in a week. On exam, crackles are heard. Suspicion for heart failure is high. Tests show a very high NT-proBNP, an enlarged heart, and fluid in the lungs, making the diagnosis highly certain. Echo reveals a weak left ventricle with an ejection fraction of 35% and a region not moving well, suggesting prior heart attack as the cause. By assembling symptoms, exam clues, lab results, and imaging, the doctor moves from symptom to clear diagnosis and a targeted treatment plan. In summary, heart failure is when the heart muscle doesn't pump blood efficiently. It can't meet the body's needs. This causes characteristic symptoms, shortness of breath, persistent fatigue, and fluid buildup causing swelling in the legs and abdomen. These signs mean the heart is under stress and needs help. Recognizing symptoms early is the most important step. If you or a loved one have these issues, especially if new or worsening, see a doctor without delay. Early diagnosis and treatment can make a big difference. Diagnosis combines symptoms with objective tests, BNP blood test, chest X-ray, ECG, and echocardiogram. BNP measures heart strain, X-ray looks for enlargement in lung fluid, ECG checks the electrical system, echo shows pumping function and structure. Together these tests confirm diagnosis, find the cause, and classify heart failure type, allowing tailored treatment. Treatment goals: relieve symptoms, slow disease progression, improve quality of life. Often this uses lifestyle changes and medications. Some may need devices or surgery. With close follow-up, adherence, and lifestyle changes, many people manage symptoms and stay active. Take the first step. Seek medical help when you notice warning signals.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.